It's never been important to me to be first. What's important to me is that you're making a difference. You just put everything you have into making a difference, whether that's at the level of the individual patient, whether that's at the level of the community, whether that's at the level of the region or the province or the country or globally.
The thing is, there's so many dimensions to her. That's the part that is kind of amazing. She has done so many different things. Her treatment for cystic fibrosis, being the editor of the Canadian Pediatric Journal, all of her consulting for WHO. I mean, she went around the world looking at vaccines and giving advice about different kinds of illnesses. And then I think, of course, being dean at Dalhousie.
Noni has been recognized as one of the founders of pediatric infectious disease. She's a member of the first generation of people who were trained in this specialty. She influenced countless pediatricians in their career development. Noni has always had a deep concern for some of the disadvantaged segments of our population. For example, during the initial stages of the HIV/AIDS epidemic, this was a terrible time for groups to be stigmatized and ostracized. And Noni was a champion for them, a champion to bring about improvements in their health and a champion to bring about societal recognition.
Son impact est incommensurable. Donc, le Noni a développé plusieurs thématiques de recherche. Donc, elle a lancé le champ de la recherche sur l'hésitation à la vaccination. Et en plus d'avoir développé une expertise, des recherches dans ce courant-là, elle a aussi contribué à former toute une génération de chercheurs qui poursuivent son œuvre. Donc, sur l'hésitation à la vaccination, mais aussi sur la sécurité des vaccins, maintenant, elle travaille sur les blessures morales ressenties par les travailleurs de la santé, les professionnels de santé publique. Donc, en plus de développer des nouveaux thèmes de recherche, elle contribue à former des gens qui vont poursuivre ces travaux-là. Donc, elle a plusieurs ambassadeurs à travers le monde.
Noni first is incredibly bright. She's a mover. She won't take no for a no if it's to improve the health of kids. And she's totally altruistic. So she does things because she believes in what she's doing. Not many people are like that. She was definitely instrumental to the establishment of the impact monitoring system in Canada, which really helped improve the monitoring of vaccine-associated adverse events, but also the surveillance of vaccine failures and potential cases of vaccine-preventable diseases. She leads fearlessly, forcefully, but in a very democratic way, which is why she's able to get consensus. So she's a role model for people who want to become a leader. You cannot imagine at times there can be such power in such a short lady, and that's really an amazing trait of personality.
Several points are really important. Work with organizations that can help move your message along to those policymakers at the national or international level. You work with communities, listen to what they're saying. Many, many times, parents and patients and people in the community have totally changed my view on what's really important. You need to really understand the problem, and you need to figure out what the answers are, and then you need to go after it. And if it's important, you never give up. You never give up.
Luminary in pediatric infectious diseases, global health, and public health in vaccine safety, Canadian Medical Hall of Fame laureate, Dr. Noni MacDonald.